Hey everybody, Dr. Shawn Talbott here today. Today on Mental Mug, we're going to talk about mood, or more specifically, how do you measure mood? So I think this question, which is a really simple question, it just says, where can I find the profile of mood states? This is a question that probably comes from the fact that I talk about this survey all the time because we use it. We use it in our clinic. We use it with our certified mental wellness coaches. We use it in our research studies. We use it all the time. Profile of mood states, or POMS. Sometimes we just call it the POMS. This is one of several ways that we measure mood in different studies, right? Mood is always going to be a subjective parameter, right? I can't tell you how you feel. You can only tell me how you feel. And the way that we do it is by using validated surveys, right? We don't just say to people, "Are you feeling good or not? Are you feeling happy or sad?" Right? It's a little more structured. It's a little more reproducible than just asking somebody how they're feeling. So the profile of mood states in particular, the easiest way to find it is just to type "profile of mood states" into Google, and what you'll find is you'll find places you can download the forms. You'll find websites where you can have an electronic version. We have an electronic version that we use in our clinical trials, where for the subjects that are in the trials that we're doing, we'll send them a link. They'll click on the link and they're able to fill out the survey by going down, click, 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 click. And what they're clicking on is profile of mood states is 65 different questions where you're asked, how likely or how well does this adjective describe you over the last 2 weeks? So in general, how happy, sad, irritable, sleepy, fatigued, blah, blah, blah. So all those 65 questions, and you go through and you answer them, and there's a certain special way that you score it. But what I like about the profile of mood states, and it's one of the reasons that we use it in almost all of our studies, is that it will give you an overall score, right? An overall well-being index that's called the global mood state. And so on that particular measurement, a lower number is a better number. It means you have less negative feelings. And so you can see that, right? Somebody might have 140 when they start, and that doesn't mean anything, right? Sometimes people will fill it out and we'll get a number and they'll go, "Is that good or bad?" And it doesn't really matter, right? And if you have a higher number, it means that you have more negative feelings, right? You have more fatigue and you have more irritability and you have more tension and things like that. But what really matters is what happens after. What's the second number? So if we do a 4-week trial or an 8-week trial or a 12-week trial, what we're looking at over time is we want to see that number come down so that you have less negative feelings and also more positive feelings, which I'll talk about in a second. So we get an overall number like that, and we can show that hey, your overall mood improved by 20% or 30% over the course of whatever this intervention is, right? It could be a sleep intervention. It could be a physical activity intervention. It could be a nature exposure intervention. It could be an herbal intervention or a probiotic intervention. It could be a number of different things, but the profile of mood states is it's very sensitive to change. So, we very often will find something. The other and the something is the subscales. So we get that overall number, global mood state, and we might see, oh, look, these people on average are feeling better. But the subscales allow us to figure out why they're feeling better, how they're feeling better. And there are 6 different subscales. So you have one for tension, also known as anxiety. You have one for depression. And both of those, anxiety and depression, the profile of mood states is not a diagnostic tool. It's not something where we're trying to diagnose somebody with major depressive disorder or generalized anxiety disorder. What we're measuring here are normal day-to-day emotions. There are other scales like the Hamilton Depression Index or the Beck Depression Inventory. There are other scales that are diagnostic that are used in trials of antidepressants and people who have major depressive disorder and generalized anxiety disorder and other kinds of disease states. That's not what this is. So when we're talking about anxiety or tension or depression or mood. We're talking about a mood state, normal everyday mood state, that all of us have, sometimes more, sometimes less, sometimes changeable, so tension, anxiety is one, depression is one, anger or irritability is one, fatigue is one, confusion or focus, brain fog is one, and then the one that I really, really like is a positive mood state. So those are all negative mood states, right? Tension, depression, anger, fatigue, confusion. Then there's a positive mood state, which is called vigor, and vigor is something that I've really specialized my research in vigor for the last 20 plus years, coming up on 30 years now, geez. And vigor, what I love about it is that it really is sort of a holistic way of feeling. It's in this kind of research, in positive psychology research, vigor is the opposite state of burnout. So when you're burned out, you don't have any energy, physical energy. You have brain fog, so your mental acuity is sort of messed up. You just feel kind of blah, right? You have low well-being. Vigor is the opposite of that. So if you have a high vigor score, you have good physical energy, you have good mental acuity, and you have high emotional well-being. And so, typically what we'll see is, if vigor goes up, some of these other negative mood states will go down. But they don't always change in the direction that you want. So, we might get a global mood state score. It might go from, let's say, 140 to 120, just to use some round numbers. And we can show, oh, clearly this person or these people, if we're looking at a whole group of people, are feeling better. And I'll put that in quotes, feeling better. But then we can go into each of these subscales and we can see, how are they feeling better? Are they feeling better because they're less fatigued and therefore more energetic? Are they feeling better because they're less depressed and their mood is higher? Or they're less tense and they're less anxious and, they're more relaxed? What is it? Like, we will sometimes see in our trials, sometimes an intervention will make somebody feel globally better. Their overall well-being index improves, but it's because of their physical energy is better. Their fatigue is lower. And because of that, they feel better. Sometimes it's more of a mental energy, so their confusion is lower, and they feel better because of that. Sometimes we'll see them all go in the right direction. All the negative mood states will go down, and then a positive mood state like vigor will go up. But you don't always see that. And so that's why something like the profile of mood state is really instructive. And then we'll combine that with other surveys. We'll combine it with, a sleep survey like the Pittsburgh Sleep Quality Index. We'll combine it with other kinds of stress surveys, like the PSS, or there's a number of different ones. And depending on the trial that we're looking at, depending on the kinds of people we're recruiting for the study, or what the intervention is, we might use different surveys and then combine those subjective measurements with objective measurements like inflammatory markers or stress hormones or physical performance. If we're looking at an exercise intervention, we might put people on a treadmill or a bicycle ergometer or something like that. So there's all kinds of ways we can unpack how somebody is feeling psychologically, mentally, and how somebody is performing physically. And by bringing all of these together, the objective measurements and the subjective measurements, like this question asked about the profile of mood states, we can get a more holistic picture of how people are feeling and performing. And then we can judge what our interventions are and really try to dial it in for people to get them to the highest level of performance that they're looking for. Okay? Hopefully that helps. See you next time.